Welcome to The Buzz. I'm Christopher Conover. This week, Arizona's ongoing efforts to combat the opioid crisis. Arizona has spent more than a decade in the grips of an opioid crisis. In the past 6 months, state troopers have seized more than 1,500 pounds of fentanyl, amounting to roughly 7 million pills. In that same time, Customs and Border Protection data show that its agents have seized more than 5,400 pounds of opioids at Arizona's ports of entry. Those numbers indicate that the opioid crisis has largely switched from our medical system to the black market. A big reason that may be the case is the more than $500 million secured through civil cases by the Arizona Attorney General's office. That money will come in from entities ranging from pharmaceutical manufacturers to the pharmacies that distribute the drugs over the next 18 years. As of the end of the last fiscal year, Arizona had received more than $36 million of that settlement money. So how did the state secure that money, and where does it go once it gets into state coffers? We start this episode with Richie Taylor. He's a spokesperson for Arizona Attorney General Chris Mays. He starts by telling us that there is an overarching theme to the lawsuits that resulted in those settlements.
These settlements are the result of, as you said, years of litigation and settlement negotiations. The Arizona Attorney General's office was involved in those efforts, as also most, if not all, state attorneys general were. And I guess the overarching theme is state and local governments to recoup billions of tax dollars that have been spent in dealing with the opioid epidemic and to help right the wrongs that were done by the opioid crisis over the last couple of decades. So it really is about making taxpayers whole for what they've already spent to address these crises over the years and to help people who are suffering or have suffered because of the opioid crisis.
In the 90s, I was working in Florida and covered tobacco litigation by the states, Florida one of the leading states on that. And we've seen a drop in tobacco usage, especially in younger people. Is that the long-term hope with the opioid suits?
Yes, and looking back to the tobacco lawsuits in the 90s and the settlements that came from those is an instructive way to look at the opioid settlement dollars. In a lot of ways, the settlement and negotiations were modeled after the tobacco settlements, but there were a lot of lessons learned from the tobacco settlements, and there was less restrictions on how that money could be spent on things that would help going forward. And so I think you see with the opioid settlements more of a defined process on how these monies get spent, what they are spent on. I believe that the tobacco money, a lot of it went into state general funds, and then state legislatures could do kind of what they wanted with those dollars in some cases. In the opioid funds, they do not go to the general fund, they go to a settlement fund, and I know we'll get into how that kind of works. But yes, looking back to the tobacco settlements is a way to understand where we hope to go forward, because as you said, tobacco use decreased, youth tobacco use decreased, lives were saved, and we hope that the same happens with this money.
Before we get into how the money was spent, let's take a minute and talk about the early part, how we get the money. Often states, municipalities are involved in these lawsuits along with the Attorney General. How much does each of the stakeholders, be it a city, a county, a town, and the state have to say? Do they all sit around a table and figure out how the work is going to be divided, or how is that handled?
As you mentioned, more than 3,000 state and local governments were involved in targeting the opioid makers and distributors in these settlements, in this litigation. And so there was a lot of collaboration going on between state attorneys general, local governments about how best to address this problem and to approach it collectively. The strength of so many different entities working on something like this is the pressure that can be put on the manufacturers and distributors. So each AG's office really played a critical role for their state in fighting for those dollars and for making sure that each state got what it needed to address the problems in our communities.
Once the money comes into the state, how does the Attorney General decide which county, which municipality gets how much money? Is it based on number of cases or programs they've got ready to go? How do you make that decision?
So, from a high level, the money that comes into our state, 56% of it goes to local governments. That's allocated directly to counties and towns. And that's based on something called the One Arizona Agreement that all of the counties and local governments participated in to determine the allocations at the local level. It's dependent on things like the amount of opioids shipped to the state or shipped to the area, the number of opioid related deaths that occurred in the state or in a given area, and the number of people who suffer from opioid use disorder in the state. So that's the high level. The state also gets 44% of the fund to allocate in different ways. And so we're in the middle of that process right now, the beginning of that process, I guess I should say, about the best way to utilize the state money, at a statewide level to help local communities and to buttress the money that local governments are getting on their own from that local government share. And so it really does depend on which programs are ready to go. We just allocated $12 million this year to several local county sheriffs to fund and help fund their jail reentry programs, which helps people, who are in the criminal justice system reenter society and be successful and get back on their feet. So that's one of the approved uses of the money, and that's what we've used our pot this year of state money to do to help at the local level.
Does that money that goes to counties have a stipulation on how it's used? Like the program you mentioned, granted that was state money coming down to the counties, but do they have stipulations?
Yes, they do. So there's something called the One Arizona Agreement, which I referenced just a little bit ago, and that's an agreement between all the local county governments and city governments and the state government, and it lists approved purposes for spending. There are broad categories, but when you boil it down, it's spending on things that will treat opioid use disorder, support people in recovery, connect people to the care that they need. Like I mentioned, with the jail programs that can help address the needs of people in the criminal justice system, and any number of evidence-based programs that help people recover from opioid use. There's a wide variety of things that this money can be used on, but there are a list of approved purposes that it has to fit into. And you can find all of those approved purposes on our website at azag.gov. But there are several categories that the spending has to align with.
Talking about your website, you all also have a list, a database of how the counties are spending the money and what money has been spent. It looks like for the last fiscal year, not a lot of money has been spent. Is that an accounting issue, or is there a reason the counties are holding it right now?
I think it's a reflection of the fact that the money has just really started to roll in the last year. And so counties are in the process of developing the local plans that will spend this money pretty strategically over the next 15 to 18 years. So it's really important that they develop those strong spending plans that take into account the feedback of people in their community, the stakeholders that are involved. You want to ensure that this is a lot of money, and you don't want to spend it the wrong way. So it's important on the front end to plan responsibly so that it can really help those in need over the course of the next 18 years.
That $12 million you mentioned that's going to county sheriffs for reintroduction for folks who have been incarcerated in county jails. What are some of the programs you're hoping to see come out of that?
That money was spent on programs that already existed, so we wanted to support programs that were ready to go, and that's what the legislature approved. Another piece to this is that the legislature, through the Joint Legislative Budget Committee, JLBC, has to approve our spending plans every year. So they supported that, and so they wanted to spend the money on something that would hit the ground right away. So these programs were already set up, were already showing success, and we wanted to be able to maximize their efforts in those counties. So I expect in the months and years to come that we'll see other counties perhaps learn the right lessons from counties who are a little bit ahead on this and maybe set up similar programs. We really want to make sure that as part of this, we're working together as a state and sharing what works, what doesn't work, so that things can be adjusted. So I think we'll learn from each other, both from the state level and the local level, on what is working and what isn't, and so that the spending plans can be adjusted.
We keep talking about these opioid suits. It's not just one suit. Do we have any idea how many suits, even just for Arizona, were filed? And are they all settled, or are some still working their way through the court system in one form or another?
Some of them may be in the final stages of being finalized, but the suits have largely been resolved. I don't have an exact number of lawsuits off the top of my head, but there were several manufacturers and distributors that were sued, names like CVS, Johnson & Johnson, Walgreens. So those are the drug manufacturers themselves, and then the distributors or the pharmacies that help facilitate the crisis. as it were. And so there are a number of different suits that came together to form this large settlement, which is over $1.1 billion that will come to Arizona over the next 18 years.
All right. Well, thanks for spending some time with us.
Sure. Happy to do it.
That was Richie Taylor of the Arizona Attorney General's office. While more than $35 million has been handed out to Arizona counties, 10 of the 15 counties have yet to report any spending to the Arizona Attorney General's office. It's unsurprising to learn that the two leading spenders so far are the state's most populous counties, Pima and Maricopa. However, third on that list, and the county that has spent the largest share of its opioid settlement money, is Yavapai County. Most of that spending has been done through a program known as Partners Against Narcotics Trafficking, or PANT. It's run by the Yavapai County Sheriff's Department. Department Public Affairs and Public Relations Director Kristen Green spoke with us and started by telling us why the county has been able to ramp up spending when others have not.
Quite frankly, we're a leader in putting the money to work because we already had an established program that we were able to put that money to use in. And that is a task force that we have with the law enforcement agencies in Yavapai County. It's called the Partners Against Narcotics Trafficking, which is colloquially called PANT. So we have this task force, and their job is to work on drug-related cases. And when the opioid money became available, it was definitely clear, at least at the county sheriff's office, that it made sense to put that money into the organization that worked on drug-related issues, including the fact that we have our first opioid overdose death investigator on PANT, which works to look at different cases to see if there's a nexus between a major dealer who is actually causing the overdose death of someone. So that was part of it. The other part is that we have such a good relationship amongst all the partners that we were able to actually pool that money. A lot of the cities that received their share of this money, they said, you know what, let's go ahead and all put it into PANT because it makes a lot more sense for us, not to take a $5,000 in some smaller city and use it for we don't even know what we could possibly get out of that, but to move it into PANT. So that's, I think, why we're one of the leaders, is that we were ready to go.
It's interesting when you talk about PANT, you said, for example, the opioid death investigator, trying to tie that back to dealers. That's a tactic that we don't hear a lot about.
Yes, the concept isn't new, but the position is new. There's a movement in law enforcement and in the prosecutorial world where the idea is that if someone, like with fentanyl, we know that a dealer is well aware that one pill can kill somebody, that it can cause a death. Now, it's not looking at a school chum who hands you a fentanyl and doesn't really know what's going on. It's not that. It's the idea of trying to trace back to major dealers, saying you're well aware that what you have is a deadly weapon, and so selling it is facilitating the death of another person. So what we're trying to do with our opioid death investigators is to try to do just that, to try to find a way to bring even more charges against a dealer that causes the death of another.
So what's the opioid crisis like in Yavapai County?
Well, the opioid crisis in Yavapai County is exactly like it is in every other county and city and community and neighborhood in the country. I can't really quantify it, but let's just say that the opioid issue is absolutely horrendous everywhere, which includes in Yavapai County.
It seems like early on in the opioid crisis that one of the things that was going on in Yavapai County is there were a lot of unregulated sober homes that a lot of kids and people from Maricopa County were coming up into. Did that contribute at all to the things going on early on in Yavapai County, or was that just a coincidence?
I'm not sure that we could tie it back to something like that. And the reason I say that is I'm sure there's some sort of factor that it brought into the equation. But again, this crisis was going to happen with or without people being moved from county to county or what. It's insidious, and by the dictionary definition, it's insidious. It just gets into the core and the marrow of a community, and it's really really hard to get out of it. I mean, I think back to, and this is of course showing my age, but I think back to the crack epidemic when when crack became quote unquote new, and we realized very quickly how addictive it was and how deadly it was, and it came on fast, and it felt like it came out of nowhere, and it was just all hands on deck to try to combat that. That's really, and again, from a non law enforcement sworn personnel, but somebody who looks out in the world, that's what I feel like happened with opioids. Is just all of a sudden, especially fentanyl, where it's been altered constantly through time to make it more potent, and it just happened fast and furious. And oh my goodness, we're running behind it constantly as opposed to in front of it.
You say we're running behind it. Is there any light at the end of the tunnel, or are we still pretty deep in the tunnel at this point on the opioid crisis?
Well, I wouldn't want to say there's no light, because we certainly wouldn't want to put everybody into a funk, and but well, I'll say there is a light at the end of the tunnel, and what that is that law enforcement and other organizations know about fentanyl. They know how strong it is. We're doing education campaigns all over to let kids know how bad this is. So I think now that we're well aware of opioids being so horrible, that we're not only running behind it with the law enforcement side, but we're maybe getting ahead of it a little bit with the education side. And I think ultimately it's all going to come to a head where we're never going to get rid of opiates, just like we've never gotten rid of cocaine or crack or methamphetamine. But hopefully we can start doing something to help, because one of the problems is it's ruining people's lives and it's killing them. And we wouldn't ignore a cancer because it's killing people. Why would we ignore this issue that's killing people?
It's interesting you mentioned crack earlier, but I will show my age. I also remember when crack arrived on the scene in a big way. And I don't remember the education component that you were just talking about, talking with kids about it and things like that. That was in the just say no to drugs era. And there wasn't that same targeted talk about crack that I hear now about fentanyl. I've seen billboards on the interstate heading up to Phoenix talking about fentanyl. And as you said, there are programs for kids talking about fentanyl. It seems maybe something was learned back in the 80s that's being applied now.
I agree. Something has been learned. I mean, I have my sort of sociologist hat on and can figure, there is a distinction. Part of the thing with fentanyl is that it's when I said it was insidious, I mean it's insidious through all socioeconomic, races. It's everywhere. We realized that it doesn't matter if you live in Beverly Hills or Compton. It's everywhere. And so I hope that we did learn something from the crack epidemic, where we were really just targeting the dealers and the users, as opposed to considering it a disease that we actually have to worry about these folks. Some of them, being, I won't say victims, but one of the things that Sheriff Rhodes in Yavapai County really believes in is that addiction and mental illness are not crimes. People with mental illnesses and addictions may commit crimes, but if we can treat and address the underlying issue, they're not going to be causing those crimes. So, I think of it that way. That I think we used to penalize the user as opposed to help the user, and that's a big difference between the crack epidemic and now.
All right. Well, thanks for joining us for a few minutes.
You're very welcome. Thank you for acknowledging that Yavapai County is a leader in spending money.
That was Kristen Green of the Yavapai County Sheriff's Department. We've heard about combating opioids on the public side, but what about the private side? Banner Thunderbird Medical Center in Glendale recently announced that it's handing out kits that include the overdose reversal drug naloxone to anyone who thinks they or someone they're close to is at risk of an opioid overdose. One of the physicians patients may receive those kits from is Dr. Matthew Keeler. He works in the hospital's emergency department.
Well, we actually introduced our naloxone distribution program at the end of this last year in 2023. It's just kind of hitting the press releases now that we're in full swing and everyone's been educated and we have a good product going out. It's been something that's been in emergency departments in Arizona now for a few years. It's supported by the Arizona State Health Services Department. They're the ones putting the funding behind this. And really the intention is to have a larger distribution program to get naloxone into the hands of the community. And naloxone is Narcan. That's the reversal agent that we use for opioid overdoses.
So what's different than a couple of years back when the opioid crisis really got going that you all decided it was time to get naloxone, Narcan out into the community?
Yeah, there's a few things that really directly affected that decision. One is the volume. We just have this increasing volume of patients in hospitals and in communities that are using opioids and overdosing. The second factor is community awareness and access to naloxone. You can probably tell by now it's becoming more widely available. You can buy it at retail pharmacies, or in some instances, it's just free over the counter now. And that is the same experience that we give our patients when they come to the emergency department. It's given to them, their friends and their family members as they're leaving the department, and it comes with great instructions. It comes with easy access instructions, not only just in a card form that they walk home with, but also a QR code that they can bring up on their phone. And it's really a step-by-step tutorial on to say, what would you do if one of your friends and family members overdosed right in front of you and you had access to naloxone?
And just to be clear, of course, naloxone is a drug, a very powerful drug, but it's easy to administer. It doesn't take the years of training that you have as a doctor.
Oh, correct. It's a 3-step process. It's open a package, approach your patient, and administer something into their nasal cavity in a single squirt in each side. It is as simple as that. I think the biggest pain point that people in the community have is the waiting. And I've heard from family members, the waiting from that first second that naloxone is delivered to that 1 to 5 minutes when they wake up is some of the hardest time to endure, because you don't know if they're going to wake up.
What difference does it make from a medical standpoint, from an emergency room, emergency department standpoint, to have more and more naloxone out in the community?
We're really trying to just combat the overwhelming overdoses and deaths that are occurring. I have said before that if we can get patients to hospitals alive, we have a very good chance at keeping them alive and having good recovery long term. If they come to the hospital and we can't get to them in time, if they overdose and die before the time that our EMS responders can get to them, we have no hope for that patient. So if community members, if friends and family have access to naloxone and can administer it to patients before EMS responders get to them, they have a better chance of survival.
What do you hear when you talk to your colleagues across the state, across the country, about their experiences in their hospitals, their medical practices? Are you all seeing the same thing when it comes to opioids?
Yes. You may think that there's a perception that because we're in Arizona, we're close to the border, that we may have a higher prevalence or experience it in a different fashion. And that is just simply not the case. This is pervasive across our country in all aspects of society, not just our indigent populations or our patients with poverty, but also high-income earners. We see it with pediatrics. We see it with adolescents and adults. It's the leading cause of death for adolescents and young adults. We see this in care homes, nursing homes, elderly patients. So it's across the spectrum. And that's the similar experience we see in Arizona, whether that's the Midwest or the East Coast.
Yeah, you brought up something interesting there. You said you're seeing it across all different demographics. This is not what many people might think of as a street drug problem, with an indigent population or something. I mean, you mentioned pediatrics and the whole 9 yards.
Yeah, the manufacturers of the illicit drugs that come into our country are intended specifically for that. They're trying to get their drug supply not just into street drugs, but into the retail drugs, the pharmacies, and in the everyday use. And we see that. We see patients come in where they think they're going to take a prescription medication, and in that prescription medication is something illicit.
All right. Well, thanks for spending some time with us.
You're very welcome. Thank you for the time.
That was Dr. Matthew Keeler, an emergency department doctor at Banner Thunderbird Hospital. And that's the buzz for this week. You can find all our episodes online at azpm.org and subscribe to our show wherever you get your podcasts. Just search for The Buzz Arizona. We're also on the NPR app. Zach Ziegler is our producer with production help from Desiree Tucker. Our music is by Enter the Haggis. I'm Christopher Conover. Thanks for listening.
AZPM's original productions are made possible in part by the Community Service Grant from the Corporation for Public Broadcasting and by donations from listeners like you. Learn more at support.azpm.org.